Flu-like symptoms before labor. If you're expecting a baby, you might be concerned if you experience flu-like symptoms prior to the delivery date. It's critical to distinguish between a virus and early labor in order to receive the proper care. Seek the doctor, and don't be worried. Flu-like symptoms prior to labor are typical of minimal concern. There are a few indications, nevertheless, that you should be aware of. In this article, we will discuss all you need to know about flu-like symptoms during pregnancy and what are the treatments for them. Let's find out more. What causes flu-like symptoms before labor? The hormones your body releases during delivery are frequently the source of flu-like symptoms. Your muscles and ligaments will relax thanks to these hormones as you get ready to give birth. As those muscles loosen, they are more prone to aches and pains throughout the body, which can make you feel as though you have the flu or cause flu-like symptoms. Additionally, as a pre-labor symptom, the relaxation of your digestive system could result in nausea, fever, and regular contractions. What flu-like symptoms do you feel? You might encounter some of the following flu-like symptoms as a pregnant woman right before giving birth. Runny nose, body pain, high fever, lung infection, body aches, sore throat, bowel movements, fatigue, stuffy nose. Typically, these symptoms last for a few days or 1 week. But given that the COVID-19 pandemic is still active, it may be wise to call your doctor, or take the flu vaccine or visit the hospital if you are seriously concerned about these symptoms. When should I expect flu-like symptoms before labor? Everybody has flu-like symptoms at different times, but most pregnant women start between 24 hours and 2 weeks prior to their delivery. It's crucial to call your doctor right away if your due date has passed and you are still experiencing flu-like symptoms so they can determine whether or not you have gone into labor. Visit your doctor or hospital as soon as possible. How soon does labor start after these symptoms? It is hard to anticipate with any degree of accuracy when labor will begin exactly after flu-like symptoms have arrived because every woman is different, and every pregnancy is unique. In general, the majority of women who have these flu-like symptoms, which is normal, should anticipate delivery in 2 weeks, sometimes even sooner. Of course, you should adhere to your doctor's instructions first and foremost if they include specifics about your due date or other aspects of your pregnancy. What other symptoms are possible signs of labor? You may also encounter quite a few other signs and symptoms before going into labor. Back discomfort and diarrhea are 2 relatively typical symptoms, for instance. As the due date approaches, it's likely that your backache may get a little worse because as the baby descends, the pressure on your nerves and spine will increase. Keep going, mother. Although these symptoms are uncomfortable, they signal that your baby is almost ready to arrive. Watch out for any additional unanticipated symptoms, such as an urgent desire to nest. Labor might be about to start if you feel like you just have to paint the changing table a light mint green before the baby arrives. Then there are the more obvious symptoms, such as dropping your mucus plug and having a bloody period. The most crucial symptom of all is then present: contractions. It is now time once your labor contractions to begin. What are the subtle signs of labor? Here are the subtle signs that indicate you're in labor. Let's find them out. 1. Lower back and cramping pain. Lower back discomfort and cramping are 2 of the most typical labor symptoms. Contrary to menstruation pains, those experienced during labor sometimes arrive in waves that last between 30 and 60 seconds and are accompanied by pressure in the lower abdomen or pelvic region. During childbirth, lower back pain is also typical. This may have an ache-like or even stabbing sensation. It frequently develops unexpectedly and is typically more severe than typical pregnant back discomfort. 2. Vaginal discharge. Another indication of labor is the emergence of pinkish or blood-tinged vaginal bleeding, which shows that the mucus plug that had been protecting your cervix during your pregnancy has started to loosen. Your cervix is dilating, which is a necessary condition before giving delivery. This indicator is only one of many that you should be aware of while your body gears up for the arrival of your child. It does not, however, automatically indicate that you are about to enter labor. 3. Hormonal imbalance. Most women have symptoms similar to the flu and cold during labor. It is typical and a great approach to let us know that your labor will be less than 2 months overdue. These hormonal changes aid in your preparation for the birth of your child. In pregnancy, symptoms might start several days prior to the start of the contraction. Body aches and pains, a persistent cough, exhaustion, and headaches are all typical flu symptoms. 4. Nausea and diarrhea. If you believe that morning sickness only occurs during the first trimester, you need to reconsider. Late in their pregnancies, some women also experience stomach distress. In the last few weeks of your pregnancy, nausea and diarrhea are frequent signs that your baby is already growing and that your uterus is pressing against your GI system. When labor is on the horizon, your hormones may also cause your muscles to relax. Because of this, many people believe that experiencing diarrhea precedes labor. 5. Removal of the mucus plug. The expulsion of your mucus plug is another indication that labor is ready to start. A thick, mucus-like membrane that may or may not leave your body gradually will be visible to you. It aids in preventing bacteria from getting into your uterus. Your cervix has begun to thin and open up if your mucus plug is being ejected. It can be a sign that labor can happen in a few hours, days, or weeks. 6. Bloody show. As you start to shed your mucus plug towards the end of your pregnancy, light vaginal bleeding may happen. The majority of women compare it to a glob of bloody discharge they discover after using the restroom and wiping. It's a frequent indication that labor may soon start, but labor may not be imminent. What does labor feel like? 3 phases of labor separate the process. A mother could feel various things during each step, from minor discomfort to severe pain. It's vital to keep in mind that every woman has a unique birth experience, and no two are normal. The first stage. For first-time mothers, this stage often lasts the longest, lasting 8 to 14 hours on average. As the cervix gradually opens up during this stage, contractions are stronger, longer, and more frequent or dilates. The second stage. This phase lasts from the time the cervix is 10 centimeters dilated until your baby's head is delivered. During this stage, contractions are much more crucial and occur in a predictable rhythm, occurring roughly every 5 minutes and lasting for 60 seconds each. The third stage. This stage starts after the birth of your child and finishes shortly after with the delivery of your placenta. Final thoughts. Close to the due date, feeling sick and flu-like is a typical bodily condition. It does this as a means of getting ready for the birth of your child. So get ready to meet the little person who will permanently alter your priorities and brace yourself. If you like this video, make sure to give it a thumbs up and also subscribe to my channel for more informative videos like this one.